Hello and welcome back to Time with Lydia, the pharmacist, the channel where we break down complex health topics into easy to understand information. Today we are diving into a very common and often misunderstood condition, peptic ulcer. Peptic ulcers are sores that develop in the lining of the stomach, the esophagus, or the small intestines, and they can cause a lot of discomfort. If untreated, it can lead to very serious health complications. But don't worry, because understanding the causes, the symptoms, as well as the treatment options available can help manage this condition and even prevent it from occurring. In this video, we are going to be exploring the causes of peptic ulcer, the symptoms, and the treatment options available. So do stick around, don't go anywhere. First of all, let's find out what peptic ulcer is. Peptic ulcer is a sore that develops in the lining of the stomach or the upper part of the small intestines, also known as the duodenum. There are two types of peptic ulcer. We have the gastric or stomach ulcer and duodenal ulcer. Gastric or stomach ulcer are sores that develop in the stomach lining as a result of damage to the layers that protect the stomach lining from the acid in your stomach. Now, duodenal ulcer is when the damage occurs in the duodenum, that is the upper part of the small intestines. Both ulcers, that is gastric ulcer and duodenal ulcer, cause similar symptoms and they are treated the same way. Now let's move on to the symptoms. The most common symptom of stomach ulcer is a burning pain in the center of the tummy. There can also be a discomfort that would occur before you eat or after you eat. That is when your tummy is full or when your tummy is empty. Other symptoms would include indigestion, a heartburn, acid reflux, feeling sick or vomiting, and sometimes also there can be a loss of weight and a loss of appetite. And now the causes. There are some common causes as well as some rare causes of peptic ulcer, and I'm going to take you through a few of these causes. One of the commonest causes of peptic ulcer is an infection with a bacteria called H. pylori or Helicobacter pylori. You can get infected with Helicobacter pylori from person to person contact, that is through saliva, through vomit, or through fecal matter from an infected person. So it can be transferred as a result of poor hygiene practices, from contaminated food, or from person to person contact. Another common cause of peptic ulcer is the prolonged use of non-steroidal anti-inflammatory drugs, and these are drugs that are commonly used for the treatment of pain. Examples are ibuprofen, aspirin, diclofenac, and naproxen. These are drugs that most of us use for the treatment of pain, but when they are used for a long time and at high doses, they can cause damage to the stomach lining. So it is always advisable that when you are not sure of any drug at all that you are taking, you speak to your community pharmacist or you speak to your doctor about it. Peptic ulcer can also occur when there is an obstruction in the stomach, which can result in the production of excessive acid. An example of a condition that can cause this is chronic kidney failure. Other causes include stress, eating spicy food, drinking alcohol, and smoking. There is very little evidence, though, that these can cause peptic ulcer, but there is enough evidence to conclude that drinking alcohol, smoking, eating spicy food, and stress can make peptic ulcer symptoms worse. Now let's move on to the treatment of peptic ulcer. Treatment of peptic ulcer will depend on the cause, and it can take a few months for peptic ulcer to heal completely. When it is detected that your symptoms are as a result of an infection with H. pylori, then you will be prescribed some antibiotics plus a proton pump inhibitor. Examples of antibiotics that are normally used are amoxicillin, clarithromycin, or metronidazole. And examples of proton pump inhibitors are omeprazole, lansoprazole, esomeprazole, or pantoprazole. This treatment regime is given over a period of 2 weeks, and it is very crucial that you finish the medication that you have been prescribed if you want the bacteria completely eliminated. Even when you feel better as you're taking it, make sure you complete the full course for complete elimination of the bacteria. Sometimes you'll be required to take the proton pump inhibitor over a longer period, possibly 4 to 8 weeks. Now, if it is detected that your symptoms are not as a result of an infection with helicobacter pylori and are as a result of excessive acid production, then medications that block acid production in the stomach and promote healing would be prescribed. A group of drugs that block acid production in the stomach and promote healing are proton pump inhibitors. And as I mentioned earlier, examples are omeprazole, lansoprazole, pantoprazole, and esomeprazole. Lately, you can purchase some of these drugs from your local community pharmacy. These drugs tend to reduce stomach acid by blocking the action of parts of the cells that produce acid. An alternative to proton pump inhibitors are the H2 receptor antagonists, and examples are famotidine, ranitidine, cimetidine, and nizatidine. You can only get these on a prescription from your doctor. Now, another commonly used group of medications are antacids. Antacids tend to neutralize the stomach acid and provide short-term relief. Some antacids will have an alginate in addition to the formulation, and an alginate would form a protective layer over the lining of the stomach, hence reducing the symptoms. Antacids generally would provide symptomatic relief and would not be used to heal ulcers. If you want to prevent further damage to your stomach, then opt in for paracetamol for the treatment of pain rather than non-steroidal anti-inflammatory drugs such as ibuprofen, aspirin, naproxen, or diclofenac, as these can cause damage to your stomach lining. Other treatment measures include reducing your stress levels, avoiding spicy food, avoiding alcohol, and avoiding smoking. I'm going to be doing a different detailed video on lifestyle measures that you can take to stop peptic ulcer symptoms. So watch out for that coming out very soon. I hope this video on peptic ulcer is beneficial. Please don't go away without giving it a thumbs up. Share with your family and friends. If you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of our informative content. Remember, subscription is free. Leave your comments and your questions in the comment section. Thank you once again for your time today, and I hope to see you soon in my next one. Bye for now.